And then for prostate cancer, there's about 9 of them that have 100% inhibition of growth in cell cultures. These are standard aggressive cancer cells grown in culture. And garlic is always at the top of the list. So this Professor Debatable also looked at other vegetables. And after the allium family with garlic and leek comes the cabbage family. So Brussels sprouts, I know for sure, is the next one after that. And then broccoli and cabbage. And then beets have an effect as well. So garlic also supports the heart, helps the liver deal with the various drugs you're taking when you're on treatment, improves digestion and immune function, and has an antibacterial and antiviral and antifungal effect. So your bowels, your urinary tract, and overall your body remains in a more protected state. This particular vegetable has a lot of function, a lot of activity. Another one, particularly for prostate cancer, is lycopene, which is a member of the carotenoid family. That's another one of these families. There's the allium family, and there's the family of the cruciferous vegetables, the cabbage vegetables, and then there's the carotene family. And we, of course, know about the carrot, but all of those brightly colored yellow, orange, red vegetables and fruits have carotenoids in them. And so lycopene is in tomatoes, and when tomatoes are cooked, as they are in the Mediterranean diet, there's a reduction in prostate and other cancers. So we do recommend the cooked tomatoes and also organic tomato paste and capsules if necessary to keep lycopene levels up, because it's been shown to inhibit progression of prostate cancer. Another superfood from the East is the root turmeric. It's an antioxidant too and an anti-inflammatory. It's good for arthritis. It has the benefit of inhibiting not only the beginning of cancer production as a general preventive, but it slows down progression and also prevents metastases from moving forward. What it does do, in the studies that we've seen, it prevents the development of blood vessels forming for the tumor to feed the tumor. Now, the next group are the plant polyphenols, which are the pigments in plants. So we talked about turmeric. It really is useful even in more advanced cancers because it prevents the development of angiogenesis. And there are many chemotherapeutic agents, some top-of-the-line new introductions to the line of chemotherapy that do the same thing. Turmeric's been doing it for a long time. It also helps the liver. Plant polyphenols are also include things like the pigments in blueberries, these dark pigments which are natural antifungals. They're part of our hunter-gatherer diet for sure, right? Gathering berries, picking the fruits off the trees. The pomegranate is a very ancient fruit. And it has ellagic acid, another type of polyphenol, which inhibits prostate cancer, not only in cell culture, but in clinical studies. Green tea also, another part of the Asian diet that has an inhibiting effect on many cancers, colon, prostate, breast, lung, ovarian has a very strong effect. All of the reproductive organ cancers, really, when you consider ovarian. Ovarian cancer cuts the incidence by half. Just one cup of tea a day cuts the incidence by half, they've been able to figure out. So there are actually studies in these cultures because, I mean, it's a cultural product, so they actually do research on green tea and also soy. And in the case of men with prostate cancer, the isoflavones in soy and other beans have been shown to be one of the reasons why the incidence of more aggressive prostate cancers and overall prostate cancer is lower. So having that in your diet as well, the bean family, is a good thing to do. It's a superfood. Green tea, as I mentioned, is useful over a wide range of cancers. There's another herb that's a Western herb, actually, not an Eastern herb, called milk thistle. It's a plant that's been used from Roman times for liver support, detoxification, and regeneration. And also in some studies, on animal studies, it's been shown to be a benefit for progression of prostate cancer. One way or the other, it's a good thing to take if you're on treatment, because the liver is the organ that has to handle the drugs that block hormones or have other effects, in chemotherapy that the liver has to deal with all these medications, and milk thistle can help your liver do better, and as a result, reduce nausea and some of the other associated side effects of taking drugs. Now, there's a famous physician who was one of my colleagues, but older than me when I started, not by much though. When I began integrative medicine in 1975, Dr. Dean Ornish was a pioneer cardiologist in his early years of his career, and he was the one that changed the way we did our business with heart disease, basically. Because when I was a young physician, our policy with heart disease was to put you in bed for 3 weeks, because if you got up and walked around, your heart might burst or something like that, or you'd have another heart attack. We thought you were weak and you had to go to bed. And of course, we were managing blood clots and emboli in the lung and the brain. And in fact, the heart got flabby, and everybody pretty well got discharged on digitalis. It was Dean Ornish and also a fellow from Toronto, Dr. Kavanaugh, who got people exercising after their heart attacks. And then Dean Ornish added to that a low-fat diet and meditation and yoga to relax the stress response, and he actually reversed coronary artery lesions and changed the whole face of cardiology. From, again, passive and let the person do what they want, to you do something for yourself, and look what's happened to cardiovascular disease outcomes. They've gone way, way down. And now cancer and heart disease run neck and neck as a cause of death. When I graduated, it was much, much higher for cardiovascular disease. That's the area we learned the important things we want to teach you. And Dean Ornish saw that the things that help for heart disease were the same things that help for prostate cancer, because exercise really helps prostate cancer perhaps more than any other cancer. So he applied his whole methodology to prostate cancer and started getting some dramatic results. And he even went as far as having studies on gene expression under the influence of his program. I just talked about the program. Exercise, low-fat diet, lots of vegetables, meditation, yoga, abdominal breathing, stress reduction. So what he found is by doing all these things, prostate gene expression, the sort of genes that are pro-oncogenic, like they cause the cancer to accelerate, were much diminished. They turned them off, these lifestyle practices. And things that enhance the immune system and reduced inflammation, things that slow down prostate cancer, they went up. Altogether, 700 genes were changed in expression. I got to tell you, there are no drugs that change multiple gene expressions. Even the most potent targeted drug would maybe affect one or two gene sequences. This whole orchestration of basically our body's self-regulating healing mechanisms only occurs with more elaborate things like changing your lifestyle in a major way. We call that a complex healing change. It's not just a supplement or a particular activity. It's a whole bunch of things. And so that's what Dean found. And to tell you the truth, broccoli wasn't quite 700 genes, but we had a slide here on broccoli and prostate cancer that was done in England, and it showed that broccoli, the sulforaphane in broccoli, changed 500 genes in the same way that the whole exercise program, the lifestyle program that Dean did. It just stopped the oncogenic signaling and slowed the cancer right down. A very significant effect. Of all the cabbage vegetables, broccoli indeed is the superfood for prostate cancer. Dean's early study was on rising PSAs in early prostate cancer. His program, this is in 2005 that he published this, vegetarian diet, exercise, meditation, stress reduction. There were two groups. The control group didn't do this. They just did their average watchful waiting, not changing anything. They had an average 6% rise in the PSA over a year, and 6 of the 46 men in this group progressed to surgery and radiation in that year. This is stage 6, Lisa, more or less. The treatment group, there was an average 4% decline in PSA over the year. None of the men had to progress. They were able to stay on watchful waiting. And the actual serum of the men who were in the treatment group were put into a colony of cancer cells that were, in a cell culture, and they inhibited the cell culture 70% in this treatment group. Somehow their immune system had changed so that it was acting on the cancer cells and inhibiting them. The control group had a very minimal effect on these cell cultures. So something was going on in the blood of the men who went on this program. It was becoming anti-cancer. Now, supplements are a part of what we recommend. Sometimes when you're on harder chemotherapy, cytotoxic chemotherapy, it helps you get through the process, and evidence has shown that it actually helps your outcomes. In prostate cancer, the treatments are often hormone blockers. However, there is one vitamin. There's a special vitamin. It's not an antioxidant at all. It's vitamin D, the sunshine vitamin. And many of you have read about it sometimes in the last 4 years in the newspapers. It's talked about its dramatic effects on all sorts of things, from getting the flu to preventing cancer, and of course keeping your bones strong. We've been getting way too little amounts of vitamin D in the northern tier where we live. So having higher amounts, as if we were having a holiday in the tropics all the time, for example, produces not only stronger bone health, but our cancer rates go down, independent of other things. The studies done that showed it was an over 50% reduction in cancer. Actually, it was 60% at the end of 5 years, and there's some like colon cancer in the 70% range of reduction of incidence, like pure prevention. There was no particular things done for lifestyle at all. But people just got calcium and vitamin D, and when they went up to 1,100 units, it started producing the anti-cancer effect. Historically, all of us believed that 400 units was the max, and 800 units would give you a kidney stone. That's way out the window. Just this last spring, Health Canada raised its levels from 400, like I said, to 4,000 was the maximum that anybody could take from 8 years age and up, and even pregnant women could take 4,000 units. Now that's a vast tenfold leap over former advice, and that's because we were finding how powerful and important vitamin D is. There's no question about that, and the amount of research done by academia in this is stunning because the public health implications of that much cancer prevention are huge. Now, of course, what happens when you have your cancer? Does it make a difference what your vitamin D levels are? And the answer is yes. We've known for 3 or 4 years that for breast and colon cancer, higher levels, say over 90, confer twice the survival rate of people who are under 60. Now, a study by Fang, I can't show you the reference, pre-diagnostic plasma, the vitamin D metabolites also reduce, if they're higher, also reduces mortality among patients with prostate cancer, same as it does for colon and breast. So just like those two other major cancers, you put them together, colon, breast and lung, and prostate rather, they're 3 of the 4 most common cancers. So we're reducing the cancer risk substantially, and even when you have the disease, keeping your blood levels up, which is what we teach people how to do, is going to make a difference. Now, vitamin D, along with essential fatty acids and fish oils, have been shown in a recent study as well to delay the progression of prostate cancer cells and change them to an aggressive and untreatable, and change them away from an aggressive state to a more treatable state. This was a study that was done in England in 2007, showing that vitamin D and fish oil works synergistically. And as I said, that's what we recommend. People take vitamin D and everybody takes fish oils. They together have an important inhibiting effect on prostate cancer progression. There's a couple of things here that I'm going to talk about, and one is there's a physician from the University of Pennsylvania, Dr. David Servan-Schreiber, who himself had cancer, and he wrote a brilliant book called Anti-Cancer, A New Way of Life. And he covers all of the major cancers with suggestions on how to maintain your health and maintain your immune system and reduce the inflammatory state of your body and the inflammatory state of your mind, in a way how to make your body a much more potent anti-cancer tool. He wrote down a couple of his main concepts. The anti-cancer mind, he called it, sort of a bit about your attitude. And the idea is optimize your mind-body connection. In other words, get in touch with your body by taking care of yourself. You want to have the time to get in touch with your body and slow down the pace of your life. And you only do that through basically taking time to rest, taking time to relax and do things that build you up, and spending some time actually just in simple relaxation or meditation practices. Getting enough sleep is also important because that's the time when your body repairs itself, including all the things that keep us healthy, the defensive systems of the body, our hormones, and our immune system. He also says, heal wounds from the past. We all have baggage we carry around that keep us in a certain state of mind, whether it's frustration, fear, anger, non-forgiveness, resentment. It's important to get rid of these pests, these psychological pests, and there are ways of doing it. I mean, there's some good books on self-care that you can read. Sometimes seeing somebody for work on that area is useful, or you work it out with your friends or family members. You at least look at those things. And if some things are significant enough that they need help, well, then help is available. I know in our integrated program we do have counselors to help people with those situations. The idea of transforming helplessness is another thing that Schreiber recommends, because a lot of us, when we get the diagnosis of cancer, we figure, wow, how could that happen? What's happening? Nothing's working anymore. And you feel helpless, and you're scared. They go together. So we want to transform helplessness into a strong belief in ourselves, gather up our will, gather up our hope, and gather up our spirits to sort of basically move into life more fully.